In today's Medco Apps Masterclass, we will learn about eating disorders. Now, there are a variety of eating disorders, but there are two most important eating disorders which we'll discuss primarily in this video lecture. The first is anorexia nervosa and the second is bulimia nervosa. Let's start with anorexia nervosa. Now, anorexia nervosa is an eating disorder most commonly seen in adolescent females, and it is a misnomer to start with because the appetite in most of these patients are normal. So, anorexia nervosa, even though the disease is named as anorexia, but actually it's a misnomer because the appetite of most of these patients are normal. So, let's start by looking at the symptoms with which this anorexia nervosa patient presents. So, the primary issue is that these patients have disturbance of body image, which means they perceive herself as fat despite being quite thin, and also there is an excessive fear of fatness and excessive emphasis on thinness of this patient. So you see the primary psychological disturbance is that these patients have disturbed body images, and hence they perceive themselves as fat besides being quite thin, and they have an excessive morbid fear of fatness and they emphasize excessively on thinness. All these leads to a restricted intake of energy, leading to significantly less weight. Now this is probably the most important point which you have to remember. So most patient the appetite is normal, however because of the psychological disturbed body image, they take less energy and there is a significant weight loss in these patients. Now the symptoms secondary to starvation are seen in these patients. Symptoms secondary to starvation can be amenorrhea, lanugo, which is body hair, hypothermia, dependent edema, bradycardia. If you see, the adolescent patients even show poor sexual development, and in adult life they may show very low interest in sexual activities. So again, these form very important part of the symptoms. So patient will have very poor sexual development, and in adult they may show very less interest in sexual activities. Finally, if you see the hormonal changes, because the growth is a little stunted, so we have increase of growth hormone and cortisol, and gonadotropins decreases with leukopenia. So these are the symptoms with which the patient presents. So if you understand properly, there is a patient who has a disturbed body image, who perceives herself to be fat even though she is very thin, and because of the disturbed body image, even though her appetite may be normal in most cases, she starts taking significantly less calorie intake, which leads to further decrease of the weight and leading to secondary symptoms of starvation like amenorrhea, hypothermia, dependent edema, bradycardia, poor sexual development, and low interest in sexual activity. So this is about anorexia nervosa symptoms. Now more importantly, if you see, they have very peculiar food handling habits which will point towards the diagnosis. They will be hiding food in house, they will be trying to dispose food in napkins, they will be cutting food into very small pieces or rearranging food repeatedly around the plate. They will be mostly preoccupied with the thought of food, spend large amount of time collecting recipes or cooking food for others, not for themselves. And these are all ways in which they are trying to reduce the anxiety, reduce the anxiety and try to control the amount of food which they take. So these peculiar food handling habits is what is very pushes the diagnosis towards the anorexia nervosa. The most important point probably you have to remember is that patients of anorexia nervosa are usually very secretive about their symptoms, and they deny any symptoms and even refuse treatment because they do not feel that they have any problem. They are very secretive, and they even refuse treatment because they feel that they are not wrong. So these are the characteristic food handling habits and attributes of anorexia. Let's look at types of anorexia nervosa. There are two types of anorexia nervosa. One is a restrictive type and the second is a binge eating or purging type. Restrictive type is what we have talked about. It is seen in 50% of the cases and highly restricted food intake. Binge eating type is seen in 25 to 50% of the patients, and here the difference is that the patients, because you remember here the appetite of the patient is normal. So what happens, the patient's appetite is normal, the patient is restricting calorie intake, restricting food intake, and at some point of time, so they are doing restrictive dieting, and at some point of time their willpower gives away and they go into a binge eating episode. So what happens is the patient, because they have a near normal appetite, they are because of their disturbed body image, they are crash dieting, they are restricting their calorie intake, and at some point of time their willpower or their capacity to withhold the food goes away and they get into a binge eating episode. Now, so there is a rigorous dieting alternating with a binging episode. The moment they binge eat, then again the feeling, the anxiety comes that they have eaten, that guilt comes in, and then they start purging. Purging may happen by vomiting, use of laxative, diuretic, emetic, and if there is a lot of vomiting and use of emetic, then you can find features like dental caries, parotitis, decreased sodium, decreased potassium alkalosis. So all these can be seen if there is a lot of vomiting. So but a very important point, and which you may need to differentiate it from bulimia, because in bulimia also there is a binge eating episode, but a difference is that patients of anorexia nervosa will overall have reduced weight and overall reduced calorie intake. Even with the binge eating episode, the overall calorie intake will be less, they will overall be thin, and they will have less than normal weight. So this is about the two types: restrictive type, highly restricted food intake. In binge eating times, the patient goes into a alternate rigorous dieting and binge eating episode. Let's move to the management of anorexia nervosa. So the management is primarily, if you sometimes you may even have to hospitalize the patient to restore the nutritional status, hydration status, and electrolyte balance. You have to remember, these patients are usually secretive. They will refuse treatment. So sometimes when they come, their nutritional status is completely off the charts. So you may have to admit them to take care of their nutritional status, hydration, and electrolyte balance. Behavioral management becomes very important, where you start praising, because if the primary defect is in how they perceive their body. So praising for healthy eating habits may be very helpful. Even individual psychotherapy and family education is very important part of the management. Certain drugs can be used. Cyproheptadine, it has been shown to increase appetite and food intake further. Tricyclic antidepressants and SSRIs can be used based on how much symptoms we have, what is the dysfunction associated with anorexia nervosa. Let's move forward, and now let's look at bulimia nervosa. So bulimia nervosa, again, it is typically episodes of binge eating combined with inappropriate ways to prevent weight gain. So here, one of the primary process is binge eating. So you have to remember, there it was binge eating was seen only in certain cases, but the primary thing was restricted food intake. Here the primary thing is binge eating and then inappropriate ways to prevent weight gain. That is the primary here. This is more common than anorexia nervosa, more common in females, and usually is in the onset is usually in adolescent. So if you see age wise also, anorexia may happen a little more earlier and bulimia happens mostly towards adolescent. So weight usually is normal. Now this is the most important point which you have to remember, because this is what differentiates it from anorexia nervosa. So weight is usually normal, and patients like in anorexia nervosa, they have a morbid fear of gaining weight and emphasis to thinness. Now because here the binge eating is there, and then patient goes to purging. So features secondary to purging can be are very evident, like enamel erosion, dental caries, salivary gland inflammation, knuckles on callus on knuckles. What happens when the patient is using their hand to induce vomiting, then involuntary closing of mouth may cause injury to the knuckles, and hence you can see callus on knuckles of these patients. Also hypokalemic hypochloremic alkalosis happens. So what happens that during MSS, HCl is hydrochloric acid is here, so because chlorine is getting out of the body, so we have hypochloremic. Because hydrogen ion is getting out of the body, we have reduced hydrogen ion, so alkalosis will be there. And also because potassium is going out of the body, so hypokalemic will be there. So hypokalemic hypochloremic alkalosis is seen as a feature secondary to purging. Management is generally because these patients, the nutritional status is relatively preserved, they have relatively normal weight, so mostly these patients are not very secretive also about their food habit and all. So the management in most cases is outpatient. Cognitive behavior therapy is used, dynamic psychotherapy is used, and in some cases you may even have to give SSRIs based on how much the morbidity is there because of the disease. Let's move forward, and now some of this Medco apps masterclass by looking at the differentiation between anorexia nervosa and bulimia nervosa. Now here you have to understand the basic problem in both is this, that they have a disturbed body image and both of them have morbid fear of fatness, fear of gaining weight. So this is the commonality in both. So both of them are eating disorders wherein the primary psychological disturbance is they have a disturbed body image and they have a morbid fear of increasing weight, gaining weight. What is the difference? In anorexia nervosa, even with the appetite normal, there is a reduced weight and you will get most of the symptoms because of the reduced weight, like amenorrhea and other, because of the starvation, secondary to the starvation. Here in bulimia, the weight is normal, weight is relatively normal, and most of the symptoms you will get is because of the purging habits, most of the symptoms. So this is what you have to understand. This is the basic concept of differentiation. So when you have a patient whose weight is relatively normal and most of the symptoms, I mean, they are not very sick patients, and most of the symptoms are basically because of their purging habits, right? So those are the patients where you will push in to the, and they have a typical history of eating, binge eating and then purging, they will be bulimia nervosa. And if you see a patient who is actually, because of this morbid fear of increasing weight, they have completely restricted their calorie intake, their nutritional status is disturbed, and they are having a lot of features, secondary features due to starvation, then those are the patients who you will classify as anorexia nervosa. Let's see the same differences. So the commonality is that both of them have morbid fear of gaining weight with an excessive emphasis on thinness. So this is the commonality between both anorexia nervosa and bulimia nervosa. However, in anorexia nervosa, generally patient will present with lower weight and diminished nutritional status, whereas in cases of bulimia nervosa, weight will be normal. Also, patient with anorexia nervosa, because of the excessive starvation, will show low interest in sexual activities, even low sexual development, whereas in bulimia nervosa, normal sexual functioning will be there. Anorexia nervosa patients are secretive, whereas bulimia nervosa patients are not secretive about their symptoms. And anorexia nervosa patient, if you inquire, if you take the history properly, if you ask the relatives, they will have peculiar food handling habits. We have already discussed these peculiar food handling habits, whereas in bulimia nervosa, there is not much of a peculiar food handling habits. Also, there was a question around differentiate between bulimia nervosa and binge eating disorder. Now, the name only suggests here there is a binge eating disorder, so there is no purging episode. Hence, the major difference will be no purging in bulimia eating disorder, hence the patient is overweight in binge eating disorder. Someone is eating too much but he or she is not purging. So in binge eating disorder, patient will be generally overweight. Bulimia nervosa, patient will be generally having normal weight, and in anorexia nervosa, the patient will have diminished or reduced weight with features secondary to starvation. Let's end this masterclass by looking at the brain teaser question for today. Loss of appetite is the hallmark feature of anorexia nervosa. True or false? If you know the correct answer to the question, write in the comment below.